I'm Dr. Smriti, going to present on the topic analysis of efficacy of alcaftadin, olopatadin, and beptostatin in allergic conjunctivitis. Coming to the introduction, allergic conjunctivitis is an inflammatory disease that is predominantly IgE mediated type 1 hypersensitivity reaction, where there is increase in histamine leading to activation of both H1 and H2 types of histamine receptors. So these are the pharmacological treatment of allergic conjunctivitis, which includes H1 receptor blockade, mast cell stabilization, and blocking of cytokine production and prostaglandin formation. So olopatadine hydrochloride, it is a selective histamine H1 receptor antagonist and mast cell stabilizer, which is also anti-inflammatory effects, which include suppression of interleukin 6 and 8 production. Alcaftadine is an inverse agonist effects on H1, H2 and H4 receptors. Beptostatin bacillate 1.5%, it has an antihistaminic activity with mast cell stabilizing properties. This study is randomized prospective parallel group study in which total ocular symptom scoring system TOS scoring was used. All patients aged between 18 to 60 years were taken in between July 2022 to December 2022. Exclusions: patients with severe allergic conjunctivitis, topical steroids or topical immunosuppressive agents, contact lens wearers, IOP more than 21 mm mercury, hypersensitivity to the study medications, ocular herpetic infection or any kind of active ocular infection, patients with steroids, antihistaminics and pregnant ladies were excluded. So total 180 patients were taken in 1:1:1 ratio having mild or moderate allergic conjunctivitis. Group 1 was given topical 0.25% alcaftadine OD. Group 2 was given topical 0.2% olopatadine eye drops OD. Group 3 was given topical 1.5% beptostatin bacillate eye drops twice a day. So total 200 patients were assessed, out of which 180 patients were taken into consideration after exclusion, and these 180 patients were divided into three groups: Group A, Group B, Group C. Group A was given alcaftadine, Group B olopatadine, Group C was given beptostatin. Then demographic data, medical history, concomitant medications, physical examination, clinical examination, vital signs, relevant blood investigations all were recorded along with the ophthalmological examinations. Then follow visits were taken on 3rd, 7th and 14th days. Then TOS score was recorded. Relevant laboratory investigations were repeated at 12 weeks. So after complete general examination, TOS score, demographic data, follow visit was taken on day 3, 7 and 14, and the patients with relapse, they were asked to visit on day 21. So this is the TOS score. So this is the TOS score and this is the hyperemia score. So this was the result which was found. The 4 major complaints were itching, redness, tearing and swelling. So early relief of allergic conjunctivitis symptoms was shown by beptostatin compared to alcaftadine and olopatadine. So by a comparative study by Dudeja, it was seen that all the 3 drugs were safe and well tolerated. So these are the results from different studies. So my strengths was randomization blinding of the patients, evidence-based option which was safe and effective, and limitations was that it was a single-centered, so comparison of efficacy and safety of study medications could not be studied. So coming to the conclusion, beptostatin bacillate and alcaftadine groups appears to be better than the olopatadine group in reducing symptoms of allergic conjunctivitis.